Stephanie Bell Flint joins us now, and today we're talking about cardiac catheterization. If you have questions, please send them to the doctors at WLBT.com.
Thank you, Maggie. Joining us is Dr. James Warnock, the Baptist Cardiovascular Services Medical Director. Dr. Warnock, thank you so much for joining us.
Thanks.
Heart cath has really been a phenomenal piece of technology in the treatment of heart disease, has it not?
Absolutely, absolutely. It is still, despite all of the advances in non-invasive imaging over the years, cardiac catheterization remains the most definitive, most important tool that we have for most patients with heart disease.
Explain to us how it works versus what we used in the past in order to treat the kinds of heart conditions that catheterization helps with.
So there are two things we can do with catheterization. One is make diagnoses, and much of that's very similar. We use a long, flexible plastic tube, advance it through one of the arteries in the body around to the heart, and take measurements of pressure and take pictures. Some of the more exciting things that we've been able to do is what we can now do interventionally, putting stents in coronary arteries, closing congenital heart defects or holes in the heart, putting in new valves. So there are many number of things that have been added to our armamentarium in doing catheterizations.
I know a lot of times your patients are awake during this procedure. Are there any that you have to put them asleep? I mean, can you do like a diagnostic one and say, hey, we see a blockage, you want to stent it now?
Absolutely. In fact, that's the way we do it most of the time. And most of our patients are lightly sedated, but almost never do we use anesthesia.
Wow. Now, how would you know, again, when catheterization would be effective and it would work, or when it would not be?
Well, usually the patients who are candidates for catheterization are patients who either need heart surgery and you need to figure out what's going on with their heart beforehand, or someone who has had a heart attack, and you know in that case that you're going to have to go in and take a look at their arteries. You don't know until after you've kind of taken the images whether a stent, for instance, would be indicated or not.
So is it the first diagnostic thing you do when somebody comes in essentially with chest pain or heart attack symptoms that appear to be, heart
Sure.
attack?
It would be, if the patient definitely has had a heart attack, it's the first thing we go to. If the patient has chest pain and they're coming into our office, there's usually some other non-invasive testing we're going to do first, and we're going to reserve catheterization for those who have abnormalities on the non-invasive tests.
Now, is this a test where you can sometimes go through the artery in the leg and then just run the catheter all the way up to the heart?
Correct. And traditionally, we've gone through the leg, but more recently, we're really excited about how many we're being able to do through the wrist, which for a patient is much more comfortable. So we can go just through the wrist, just where you were feeling your pulse, put in a fairly small catheter there, and then do the same procedure. And when we're finished with the procedure, the patient's actually able to get up, go to the bathroom, sit up in a chair. They don't have to, lay flat on the bed for 3 or 4 hours like you would if you went through the leg.
Well, I know when you go through the groin, a lot of times there's a risk for infection or complications and all sorts of stuff. Is that lower when you go in through the wrist? Absolutely.
So it's clearly one of the more common complications from catheterization is bleeding, and sometimes the bleeding can be life-threatening. You almost never see a vascular or bleeding complication when you go through the wrist, and some recent studies now show that in the most serious patients, like patients who've had a heart attack, the actual risk of death is less if you go through the wrist instead of the groin.
Dr. Warnock, we're running out of time, but the last question would be this. If a person suspects, if they are having any symptoms, the best thing to do is get to an emergency room as soon as possible, or call the ambulance.
Call 911. If you think you're having a heart attack, call 911.
All right. Dr. James Warnock with Baptist Cardiovascular Services. You're the medical director there. Thank you so much.
Thanks.
And for the latest health news, log on to our website, WLBT.com, and click on Medical Matters.